Dr. Robby is one of, if not the strongest doctor they have in the pit, and you can see he's been slowly unraveling this season. Now, I'm gonna just start from season two because season one, we already know he had his breakdown and he was actually still grieving the death of his mentor from COVID. But season two, he's acting like everything's fine, but I feel like there's some signs that show he is not fine. And in fact, there may be a tragic end coming if there's no intervention. Season two starts with Robby coming into the ER for his last day before he goes on his little sabbatical and goes on a road trip on his motorcycle. And of course, everyone is making fun of him for this. This seems like a midlife crisis in a joking manner to them, but I think it's actually kind of a cry for help. Robby doesn't seem like the type of person who can stop cold turkey working, even though it may be the best thing for him. The fact that he is not confirming to his best friend, Dr. Abbott, that he is still going to therapy and that this isn't a cry for help and that if he needed help, he would call Abbott is a red flag immediately. Now, we start the shift and he is acting like everything is fine. He's coordinating the junior staff. He's taking care of trauma cases. He's dealing with the doctor Al Hashimi, who came in to begin covering him while he's gone. And everything seems like it's okay, but there are little clues that show that Robby is emotionally still kind of messed up. Maybe not even from Pitfest, but from beyond that, just the day-to-day wear and tear from the job. Now, I want to say one of the red flags is how he mentors Langdon versus Whitaker, but honestly, I think he just may still be hurt about what he perceives is Langdon's betrayal. Langdon was also a very strong doctor in the last season, and he may have been his star resident. And to find out that you didn't even notice your star resident was stealing patients' meds to feed his addiction, maybe makes Robby blame himself along with Langdon. And even after Langdon comes back from rehab and is ready to jump back in, he can't really fully trust Langdon. And I feel like it also is reflecting that he can't trust himself and his own judgment to trust Langdon can do his job.
Okay, I'm just gonna say it. I'm sorry. I betrayed your trust. I betrayed our patient's trust. And I'm really fucking sorry. It'll never happen again, I swear. I'm really glad that you got the help that you need. But I don't know if I want you working in my ER.
Because he won't even let Langdon do basic trauma cases that didn't seem like last season Langdon really broke a sweat over. But he has him doing little baby stuff, I guess you can say, that the med students can take care of. And this is really, and you can see the huge difference in mentorship between Langdon and Whitaker, because Whitaker looks like how his interactions with Robby may have a new favorite in Whitaker. Whitaker is emotionally stable, if not a little bit nervous. He cares about his patients the same way Robby does. He's smart. And in fact, he is taking the role of mentor to the new med students who've come in. And I want to just skip to the most recent episode that really set this whole video off for me, where Robby has a one-on-one with Whitaker in the break room, and he tells him he understands that he cares about his patients, but it's kind of inappropriate for him to help the widow of a patient who passed away the way he is.
What about her friends and family?
Yeah, they're around.
Supporting her?
Yeah, I think they try to, but mostly she's just leaning on me.
Robby is warning Whitaker he's giving too much to the job, and so he doesn't end up like him. Now, the part that's the red flag for me is that Whitaker, I don't know how many people know Whitaker was unhoused. He was living in the hospital. I think maybe only Trinity knows, but now people know that he lives with Trinity, Dr. Santos. Now, the red flag for me is that Robby asked Whitaker to come house sit for him while he's gone.
Hey, you want to do me a favor?
Yeah?
You want to house sit for me while I'm gone? You'd actually be helping me out, and you could save some money on rent.
Are you being serious?
No smoking, no parties, no pets, no babies, yours or anybody else's.
We don't know. I don't have a baby.
No, but she does. I was going to ask Abbott, but he does nude yoga at sunrise, and I don't think some of my elderly neighbors would survive seeing that.
Yeah. Yeah, that would be amazing. The house sitting, not seeing Abbott's naked yoga.
If I don't come back, you got to swing back, okay?
I don't know why, but immediately I was thinking, I can't say the word, unaliving. I felt like Robby was planning to unalive himself, and he's giving his stuff away to people he cares about. And I wouldn't usually say that. I wouldn't jump to this conclusion, but we know Robby hides his emotional pain a lot. And the fact that he ignored Abbott's request to call him if he needs help and wouldn't confirm he's still going to therapy, I feel like something bad is going to happen. Anyway, let's continue. Now, Langdon attempted to apologize and make amends. I'm assuming this is part of his process for his recovery. He tried to apologize and make amends with Robby, and Robby was not trying to hear it. And I felt like that was a little uncharacteristic of him. He seemed like he was always willing to at least hear people out, but I think the betrayal is still too fresh. I can't remember how many months has passed between season 1 and season 2. But he's like, I can't hear this right now. And I wonder if their relationship is ever going to get back to the way it was, which is sad because Langdon looks like he really is taking responsibility for his actions. He's not in denial about what he did. He's really just trying to clean up his mess. In fact, he took the extra step to apologize to a patient for stealing his pills in the past. And I think the patient took it well. May he rest in peace. I think his name was Louis. He actually took it well. I would have been upset. But Louis had his own situation, and I think I'm going to make a video about the patients that were featured in season 2 because a lot of them were really impressing me with their acting skills and their backstories, but we'll get to that later. Like, the healthcare field is not an easy field to work in, especially since on the news I see a lot of patients are getting violent with the people taking care of them. Like, your frustration is resulting in you causing physical harm to the people who are supposed to be taking care of you. It's going to set people on edge. But in the show, it's even more apparent that it's not just the physical harm, but the emotional harm they're taking on. Screaming patients, patients dying. You're giving your all thinking you can save someone and they pass away in your arms. And Robby tries to institute moments of silence and reflection for patients that pass away. But I'm sure the pressure is mounting on his back. I think last season, he went through a whole monologue of listing people who passed away. That shows he doesn't really let them go. It's not that he just remembers them. He carries the weight of their deaths, every single one, on his back. So that means he's never really relaxing. I wonder if he even celebrates the successes, the hard cases he is able to save someone. And that's why I'm really, really interested to see where this final episode is going to go, because it's very obvious to me that Robby is depressed. It doesn't seem like he's handling it well. He's planning a months-long road trip where all he's going to have is his thoughts. And I feel like that may not be the best thing for him. I feel like he needs some professional help, and I'm glad Dr. Abbott has clocked him, and I hope Dr. Abbott or someone else can intervene before it's too late. And I'm glad they really took this turn with his story because I want them to show what it looks like where the person everyone depends on is not okay and no one notices, and how important it is to check on people that you usually rely on for everything. They may be silently struggling. And I think one of the huge signs that mental health professionals say is a cry for help is when people start giving away their possessions, especially big possessions, which is why that whole giving, I know he hasn't given Whitaker his house, but he was like, house sit for me for a couple months. You would give someone you supervise your home for a few months, and Whitaker's not unhoused anymore. So what is truly the purpose? He hasn't said he has pets or plants or anything that Whitaker can watch. He's slowly giving things away. I'm interested to see in the next episode, does he start giving other things away? He is going to other doctors like Dr. King and giving well-meaning advice because she's super nervous about her deposition. And he actually slows down to give her well-meaning advice to calm down, that she's an amazing doctor. He's complimenting people. And I hope he'll be okay. If you want more character breakdowns from the Pit, let me know which character I should analyze from season 2 next.